Complete the conversation based on the case history in the opposite. Doctor, what seems to be the problem? Patient, I've been getting palpitations. Doctor, how long have you had them? Patient, about 6 months. But I've had heart problems for years with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep on 3 pillows. I had a mitral valve replacement 3 years ago, and that improved things for a while. Make word combinations using a word from each box. Two words can be used twice. Look at B and C opposite to help you. At rest. Atrial fibrillation, cardiac output, heart failure, on the fourth, beating edema, premature beats. Write the words a patient will use to describe the symptoms below. Look at A, B, and C opposite to help you. Number one, dyspnea, shortness of breath. Number two, arrhythmia, palpitations. Number three, orthopnea, breath, breathlessness when lying flat. Number four, edema, swelling. Complete the case report. Look at A, B, and C opposite to help you. Case 13. A 60-year-old woman attended her GP's surgery complaining of breathlessness on the fourth. This had been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had had several episodes attacks of fats palpitation which lasted 20 to 30 minutes and were associated with some shortness of breath. She had noticed some swelling on her of her ankles, but at the end of the day, these disappeared overnight. Complete the table with words from A opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Verb, auscultate, noun, auscultation, examine, examination, inspect, inspection, palpate, palpation, percuss, percussion. Put the steps for examining the heart and circulation in order according to the four-stage system. Look at A opposite to help you. Look for clubbing. Number one. Feel the radial pulse. Number two. Locate the apex beat. Number three. Note any thrills. Number four. Measure the heart size. Number five. Are there any murmurs? Number six. A doctor is presenting the case of for the 3-year-old woman at a meeting in the cardiology department. Complete the test of her presentation. Look at the opposite to help you. On examination, she was pyraxal with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180.
and was irregular in time and force. Her blood pressure was 130 and 80, and her JBP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulses were all present, and there was not central or peripheral diagnosis. Her apex beat was displaced to the anterior axillary line, but still in the fifth intercostal space. Her heart sounds were very interesting. Where she was initially examined, it was noted that she had pensystolic and diastolic murmurs heard best at the apex. When she, when she was examined some hours later, there was a harsh pericardial friction rubs all over the pericardium. Our diagnosis at that time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation.